I'm a fellowship-trained breast surgical oncologist, and this is my new series called What to Do When You've Been Diagnosed with Breast Cancer. And the point of this series is to help women who have recently been diagnosed, help them ask the right questions to their doctors, especially when they may not have access to a second opinion or their doctor may not be on social media in order to give them a little bit more education and guidance. And this series is, of course, also for all of my current patients as well as my future patients and my past patients to learn a little bit about how I walk through this process with my patients. First things first, you've received the diagnosis of breast cancer. Getting that news is so overwhelming, and most of my patients say that they didn't really hear anything that happened after that because they were just processing that they were told they had breast cancer. Some of them do get online and do some research, and if that's you, the places that I would avoid doing any kind of research are Facebook or talking to other people that you don't personally know about their breast cancer journey. Sometimes my patients have other people in their circle of family and friends who have been through breast cancer, and having those people there for our consultation and through the process is so helpful. But talking to people that you don't personally know can be overwhelming at times. So I would caution you against it. If you're someone who needs to do some research and wants to prepare yourself, good places to start are the American Cancer Society. Susan G. Komen also has a lot of great resources for patients who have recently been diagnosed with breast cancer. Additionally, your radiology group or your surgeon's practice or your medical oncologist practice, depending on who you get referred to, may have a nurse navigator who can reach out and send you some resources if you want to do any reading. Now, you don't have to do any research. If you are someone that just needs to take time to process, that is totally okay. And I promise that I will give you all of the information that you need, and I'm going to make more parts to this series so you're asking the right questions and you get all the information you need from your doctors as well. And to close out part one, I always like to explain images to my patients. So this is actually a mammogram of a patient who was diagnosed with architectural distortion. The arrows are pointing to a wider area in the sea of this whole white area, which is actually dense breast tissue. And it doesn't really look like a mass, it just kind of looks a bit weird. This patient probably had additional mammograms and an ultrasound, and then an ultrasound guided biopsy that demonstrated that this was a lobular breast cancer.